All right, everyone. Hello and welcome. I'm so excited to be presenting today on our webinar series. I want to thank Dr. Katie Toe for featuring me, a periodontist, on this series. And I'm really excited to talk to you guys about the differences between a ceramic implant and a titanium implant. So if you've ever been told that you are going to lose a tooth, or let's say you've already lost a tooth, or even if you're just trying to live in the healthiest way possible, this webinar, this presentation is going to be for you. Okay. Tonight, what we'll do is we'll talk about what a periodontist does. That's my specialty. We're going to talk about the two different kinds of implants, and then we're going to talk about why many health-focused patients nowadays are choosing the metal-free ceramic implant. We'll spend about 35 to 40 minutes together, and then we will leave about 15 minutes at the end of the presentation. So if you have any questions, please feel free to just drop them in the chat, and then we'll go over them at the end. Okay, so welcome and thank you for coming. I'm going to tell you a little bit about myself. My name is Dr. Rosalie Gulla. I am the periodontist here at Dr. Katie Toe's office in Katy, Texas. I was born in California, and then I moved to New Orleans whenever I was 8. I stayed in New Orleans, and I graduated college from New Orleans, went to high school college in New Orleans, and then I did my dental school training at LSU School of Dentistry. Eventually, whenever it was my third year of dental school out of the 4 years that we have, I decided to specialize because I really loved what periodontics was all about. So then I applied, I got in at UT Health of Houston, and that is how I ended up here in Houston. For my master's, I wrote a thesis on the survival rate of implants placed in previously failed implant sites, and I looked at the factors that affected the outcome. So needless to say, I have been really focused on implants throughout my entire residency and really a lot through my career as well. I am married to my best friend, AJ, and we have 3 kids. I have 2 older bonus kids. Haley, she's 13. Julian just turned 11. And then in this picture below, I have Charlie, and she is 2.5. And so I would say, and then you can see in this picture here, she has something red on her eye. I would say that her journey with her eye and, taking care of her in that aspect was a real turning point in my life because I've always practiced, a biological lifestyle. I ate organic foods. I was very holistic in my own lifestyle. But this whole experience pushed me to dig deeper. And with that, it kind of changed my principles and my philosophy towards dentistry, which is ultimately what led me to biological periodontics. And then that's why I'm here today. Now, let's start. What does a periodontist actually do? I think most of you might not even recognize that word, not even really familiar about what it even means. And to be honest with you, I was a dental assistant for 6 years before I went to dental school. And every single time we sent a patient to the periodontist, it was because we did a deep cleaning and it didn't get better. So I thought that a periodontist was just someone who really specialized in deep cleanings, and I just didn't even think anything of it. And then even whenever I went to dental school, I was in my 3rd year, like I said, and most people who know they're going to specialize are already going to be applying, getting their applications ready. But I realized I loved it whenever I actually sat down and I saw someone suturing, and I was like, this is what I want to do for the rest of my life. So what do? We are highly specialized dentists, and let's just say, to make it very simple, we focus on the gum and bone, okay? We specialize in the gum and the bone around the teeth. We diagnose, prevent, and treat gum disease, which is the leading cause of tooth loss, and we also diagnose, prevent, and treat gum recession. We make sure that the foundation is healthy in the mouth, so we make sure that, your teeth, not only your teeth, but your gums and your bone are stable and healthy for your natural teeth and for a dental implant. We support tooth longevity. So our treatments protect your existing teeth and contribute significantly to the long-term success of dental implants. And our residency, our specialty, really focuses a lot on dental implants. It's not one of those, let's take a weekend course and learn about an implant. throughout our 3 years, we learn about dental implants, the pros, the cons, how to navigate around them, how to navigate around complications. So, you know, we are dental implant specialists as well. Now, I would compare our specialty to a house. You have a beautiful house, all right? You bought your dream house. You've been working your entire life. You provided for your family. Now you get to have your dream house. It's beautiful. It's got all of the expensive furniture. Let's just say the restoration hardware cloud couch is in there. You've got everything that you want. Your beautiful family lives in there too. But if you build it on a faulty foundation, what happens to that house? It doesn't matter what's in it. It doesn't matter what you fill it with. It doesn't matter how much it costs. What happens if you have a faulty foundation? The entire thing goes crashing. So that's kind of like what our teeth are, right? As my specialty, where I'm focusing on the foundation, you can spend hundreds of thousands of dollars on fillings, crowns, veneers, braces. But if you don't have a strong, solid foundation, what's the point, right? You're going to end up losing it all anyway. So that is what a periodontist does. But what I'm going to be doing today is I'm going to be focusing on the dental implant specialist part of it. And I'm going to be comparing our two most popular types of implants. Most people are familiar with titanium. Titanium is the silver implant. Some people might have heard of ceramic and then are here to learn a little bit more. So I'll tell you the difference between them. Okay. But first, let's go over what an implant actually is. If you lose a tooth in your mouth, you lose a tooth, but also you lose the root of the tooth. The implant mimics the tooth root. So generally what happens is you'll get the implant first, wait for that to heal. The implant goes into bone. And then later on, you go to the restorative dentist where they create a tooth, they create a crown to place on top of the implant. So it is a two-parter. You see me for the surgery, and then you see someone else for the restoration. I always say I'm the bad guy because I'm the one that has to do surgery and then, numb you up. And then like in our office, I was like Dr. Katie, Dr. Lou, Dr. Jones are going to be the good guys because they're going to be the one to place the crown on top and they're going to be the ones to make it look pretty. So both implants, the titanium and the ceramic, have very good clinical success, but I'll kind of go over in details about which implant is best for your body. So choosing the right material does depend on the patient's unique biological profile, systemic health considerations, and aesthetic goals. They're both excellent choices. They're both well studied. And so I'll go into titanium because as you can see here, it says over 50 years of clinical research and real world outcomes. Basically, the way that an implant was discovered was by Dr. Brannemark. He was running experiments on rabbit tibia, which is rabbit bone, live rabbit bone, and he placed a titanium mesh or some type of titanium into the bone of the rabbit. And then whenever he came back, he saw that the bone healed around the titanium. What that healing is called is osseointegration, which means that the material has integrated with the bone. Titanium is it's lightweight, it's a medical metal. It is silver gray in color, and it is highly trusted in medicine. So if anyone here has a hip or a joint replacement, it's all made of titanium. It has a well-characterized systemic profile with broad acceptance in the body. So this is the most common implant that people are getting. And it is ideal for patients where long-term predictability is a priority. And the reason why that is because it has a proven track record of over 50 years. Now, the other type of implant is the ceramic implant or zirconia. So you're going to hear me kind of interchangeably saying those two words, ceramic, zirconia. They're the same thing. Zirconia is a type of ceramic. This is going to be your metal-free option. These implants are naturally white, and it is a newer option, but it is quickly growing. Um, it is often made of one piece, and there's no metal at all. And I'll go into a little bit more detail about what I mean by it's made in one piece. Since it is not made of a metal like titanium, you don't get that metal ion release like you get from titanium. It is a naturally inert material, which means it doesn't cause any reaction in the body. So this is good. This is a good option for anyone who has a metal sensitivity and or an autoimmune disease. And it supports the whole body health goals through a biologically neutral solution. I'm going to go into a little bit more detail for both of them. We're going to review the pros and cons. On the left here, you can see the image of the titanium implant. Like I said, it has a long historic profile. It has a lot of research in it. And that is why a lot of people are so hesitant to move to another type of implant material because this one has the research backed up for it, right? As you can see in this photo here, it is made in two pieces. The first piece gets placed into the bone. And then, like I said, the restorative dentist comes back afterwards and places the crown on top. The pros for a titanium implant, so just a reminder, the titanium is the metal one that is gray, is that it has excellent osseointegration with the natural bone tissue. So remember, osseointegration means that the body takes it in well and it integrates and becomes one. It fuses around the implant and then it becomes really strong and holds on to the implant. It's usually in two pieces. It is versatile for complex anatomies and angulation, and it is well documented long-term. So, this is the same thing that I keep talking about, that it's well documented. And so long-term wise, people know a lot about it, let's just say. Now, I'll talk about the cons a little bit as well, but going back to the two-piece here, the reason why this is a pro is because some patients don't have a lot of bone. And so, or the angulation of the bone might be a little different or a little off. So when we place the implant, because it comes in two pieces, the connector piece that goes in between, which you can see here, can be re-angulated so that it goes into another direction. Let's say if your bone isn't in the most ideal position, you can still place the implant and then have the crown in an ideal position because the connector piece that goes in between can re-angulate. That's the pro. That's a major pro of the two-piece titanium implant. Another pro is that because it comes in two pieces, you can bury it. And what do I mean by burying it? In this picture here, you can see that the implant goes into the bone. If we don't, the crown comes later after the initial healing period. But what happens afterwards is that, your periodontist will suture it and then the gum tissue will cover it again. And then whenever the gum tissue covers it again, it gets blocked out from the environment, which then protects it from the outside oral environment. That's a major plus. And especially if a patient might have soft bone, if you're going to be able to bury the implant, it allows it to heal in a more safe environment. Now, the cons of the titanium implant. Number one con, it is a metal. So if someone has a metal allergy or they just don't want metal in their mouth, they are not going to want the titanium implant. The titanium is actually made of a medical grade titanium, which explains why the medical community uses it for hip replacements. So it's usually pretty good, but that's only if you're going to be using a high grade titanium. Some titaniums are made of alloys. So some titanium implants are made of alloys. There is a potential for galvanic reactions in certain oral environments, and it's not really good for some people who report that they have a metal sensitivity. Now, like I keep saying, it is a gray colored implant. So whenever it comes through the gums, if you have thin bone, thin tissue, and you end up getting recession, you're going to see a little bit of that gray show through, which isn't always aesthetic, right? Nobody wants a gray gum line on their tooth in their mouth. And so now we're going to look at the pros and cons of the ceramic implant. The ceramic implant, the pros are going to be some superior biocompatibility. And the reason for this is because they are inert. They are made in their most oxidized state. So that means that with further oxygen and saliva and exposure to the environment, there is no corrosion, which sometimes you can see with titanium implants. Another pro is that it is a metal-free option, which is ideal for the whole body health approach. This one is my favorite. Low bacterial and plaque adhesion. The way I explain it to my patients is that the ceramic implant is so smooth that plaque and bacteria can't even adhere to it. So whenever patients come in and they've eaten a meal, all their teeth next door could be dirty, but then nothing sticks to the ceramic implant. This can be a pro and a con, and I'll explain a little reason why later, but it's a major pro because if there's no bacterial or plaque adhesion to it, then there is a less chance of bacterial infiltration and infection and things like that. It is excellent for patient with metal sensitivities, and it has a tooth-colored aesthetic. So if you do have that thin profile where you have thin bone, thin tissue, you get a little bit of recession, at least it's white and it's not gray. So whenever you're smiling, you can't see that there's a gray lining on it. The con is that it is very brittle. Now, what does that mean? The ceramic implant is very strong. It is very strong. It is just as strong as a titanium implant, but it is so strong that it makes it brittle. So think about ceramic. Think about your sink at home, okay? Your kitchen sink, let's say. No, my kitchen sink is ceramic. I'm not sure if everybody else's kitchen sink is ceramic, but let's say your restroom sink. Strong, right? It can withstand a lot of forces, can withstand a lot of pressure. But if you drop it out of a second-story building, what's going to happen to that ceramic? It's going to break. So the same thing with this. If you have too much force on it, there is a chance that it could fracture. Now, what do I mean by too much force? Number one, whenever the practitioner is placing the implant, if they're torquing it too high, placing it way too high chance of breakage. If you are a clencher and a grinder, constantly just gnawing on your teeth all day and night, high chance of breakage. If you are chewing on raw carrots all day, cashews, nuts, probably not a good idea, okay? That's going to be way too much stress. Now, titanium implants fracture as well, but I will say that ceramic implants have a higher risk of fracture. Another con is because since they are more newly on the market, they have fewer long-term studies when compared to titanium, but the evidence base is growing. Now, the last con is going to be that usually it's one piece. So unlike the titanium implant where you can really just kind of re-angulate everything, this ceramic implant is going to be one piece, which means that it will require surgical precision, which means that you might need a bone graft before to really build that solid foundation for this implant before you get it. You cannot re-angulate it with a second piece because it's one piece, so it makes placing it very difficult. I'm going to go into a little detail about the healing so you know what to expect during the recovery period. Both implants, I will say, are excellent. You know, post-operatively, you're going to definitely need to make sure that your oral hygiene is meticulous, that you need to be taking care, that you're coming in for your maintenance appointments. But there are minor differences between the two. For titanium, I will say it is a simpler recovery because it has that two-piece design. The two-piece design allows for the implant to be buried beneath the gum. So that's what I was talking about earlier in that photo. You can see that because it's being buried underneath the gum, it gets to hide from the oral environment, which I always tell all my patients that the oral environment is a hostile place. You know, there's all sorts of bacteria in there that you can't control. So whenever you have something that's buried, it kind of keeps it safe, especially if you have soft bone. There is no external appliance required during the recovery, which is kind of what you see right there on the left, that retainer, that Invisalign retainer that you see. So overall, it is a shorter, more straightforward healing process. On the other hand, the ceramic's one-piece design means that the implant cannot be buried underneath the gums. I'm going to show you guys a picture of this so that it makes a little bit more sense. The implant does remain exposed. So that means that you may have to wear a retainer for up to 6 months of while this is healing. So the timeline for healing is a little bit longer when compared to titanium. The retainer, the reason why it is necessary is because it is exposed to the oral environment. So this is what I always tell my patients. Your tongue has a mind of its own. When you're sleeping, you have no idea what it's doing. It literally can roam around and push the implant out. I had a patient who was awake and pushed it out with his tongue. Remember earlier, whenever I was talking about the ceramic implant, about how smooth it was, and so the bacteria doesn't attach to it? Well, this plays into this part again. The ceramic implant is so smooth that I say whenever I place it, it's so smooth that your tongue, which is a strong muscle, can push it out. In addition to that, the retainer at night helps to block your tongue away. And then during the day, you have to wear it as well because while you're driving, while you're sitting watching Netflix, you're not really aware of what your tongue does. It could also push it out. And then on top of that, you have to wear it while you're eating because if you chew and you bite down on something, it will also make the implant come out. So it's a pretty rigorous post-operative recovery, but I will say it is like an Invisalign retainer. So if you're already wearing your aligners for braces, it's the exact same thing, except you're not taking it off to eat. You're leaving it on to eat. The type of diet that you're going to be on after the ceramic implant is going to be a soft food diet. No, you do not have to be on juices and liquids for the entire 6 months, but whatever food you eat has to pass the fork test. So what is the fork test? Basically, if you can cut it with the fork, you can eat it. That will be for up to 6 months. The ceramic implant takes anywhere between 4 to 6 months to heal. These are some examples of some implants that I placed. The picture all the way on the left was a titanium implant. You can see that it is buried underneath the gum, so it gets protected from the oral environment. Once the titanium implant goes in, I always tell the patients, you're going to leave here exactly the way you came in. You're not going to get a tooth on top yet. You're not even going to see it coming through the gum tissue. So basically, once the stitches are removed, they can pretty much resume everything like normal. Depending on the torque, which is the strength at which the implant goes in whenever it's placed, will dictate whether it takes 3 months or 6 months to heal. If the bone is soft, it might take 6 months. If the bone is really hard, then it could take as little as 3 months. The middle picture is the one-piece ceramic implant that I was talking about earlier. You can see that there is a nub coming out of the gum tissue. So if this patient bites down on anything, that implant is going to fall out, right? The implant system that we use actually has a two-piece, but I say two-piece with quotation marks because it's still one piece because it still comes through the gums, which is the picture all the way on the right. The picture all the way on the right, you can also see that the tissue really loves being around these implants. It is very biocompatible and gum tissue loves it. I had a patient that came in today and she was like, my tissue is growing over my implant. And I was like, that's what we want. Do you know how hard it is to grow tissue? Do you know how hard? That's like what my entire residency was based on, trying to grow tissue. And here it is just creeping over your implant. That is a blessing, okay? And then this picture down here, the one all the way on the right, You can see that the implants were placed on the left side of this picture, and then on the right side, where the other implants were placed, are already healed. So the left side of the picture is the post surgery, and then the one on the other side is already healed. So it's just very pink, very healthy, very clean. Here is an image of that same patient with the titanium implant being placed. So the titanium, like I mentioned earlier, is going to be that silver color. This patient has great bone, great gum tissue, but look at the picture on the right. You can see that even though, the implant is buried, the gum tissue is healthy, the bone levels are great, you still have a little bit of that silver show through. Now, that's not always the case, okay? But in an aesthetic area, do you want to risk that? Right? Here's another example. We have a patient who had a root canal. He ended up getting a cavity underneath that crown. I had to take that tooth out, and I was actually able to place the implant in on the same day. This is a front tooth. And my colleague, Dr. Pham, she did the crown on it. And then you can see for the front area where you don't want that silver show through, the ceramic implant might be a good option. It comes out really pretty. And I will say, this gum tissue looks great. So I don't know if there's any periodontists watching this, but this is a great outcome. Now we get to the part about biocompatibility. So in our office, at Dr. Katie Toe's office, we check the biocompatibility of all the dental materials that are used in this office with every single patient that walks in. So in regards to the implant, the titanium and the ceramic implant, both can achieve successful osseointegration, but the material is going to be important for each individual patient for a broader long-term wellness perspective, right? I have two examples here, and these are real life patients. On the left-hand side, you can see that, like I said, titanium has its proven historical research. This patient on the left, you can see that we've tested her for all of the sutures that we use: silk, chromic gut, PTFE. Then we have the ceramic implant. Then we have the titanium implant. And then we have the bone grafting material. But this page is actually 2 pages long. So we test for all the dental materials. This patient, green means good. This patient was biocompatible with both titanium and ceramic. So she, long term, inflammation wise in her body, she can get both. She can handle both implants, whatever she decides, right? I would feel more confident placing any type of implant. I mean, anything. I mean, she's green. This patient was actually green all up and down the list. On the right side, we can see here I have the legend. So anything that is red means it's going to be weakened. Green is good. Yellow means it's going to stress them out. So in this patient, you can see that she is biocompatible with the ceramic implant, but whenever we test her against the titanium, it causes stress in her body. Now, does this mean that she is allergic to titanium? No. This is not an allergy test. A biocompatibility test is not going to be an allergy test. What the biocompatibility does is it just tests whether that material is going to sit well in your system. Is it going to cause chronic inflammation? Is it going to block an energy center in your body? Is it going to potentially cause downstream effects? Now, if I place a titanium implant into a patient that shows up with red, is it going to fail? Not necessarily, but there is a chance that it could maybe cause some type of downstream effect, or maybe in a few years, she might start to develop something. We don't know, but I'm not going to risk it. A thorough biocompatibility assessment, including systemic health history and individual sensitivities, very important, and we do that with every single patient. So your smile is our priority. Again, Dr. Katie Toe Center of Wellness Dentistry. We combine advanced diagnostics with personalized care to build a plan that balances durability, aesthetics, and long-term wellness. We have a CBCT machine. A CBCT machine is a 3D imaging software. It's like an X-ray that goes around your head. What it allows us to see is the nerve, the sinus, the amount of bone you have, so that we could safely place an implant without going into your sinus, without pinching a nerve. Our plans are built to last for long-term wellness. So everybody gets a personalized consultation. So book yours today. If you have any questions, you can find me on Instagram. I'm at the Biological Periodontist. I post a lot of videos because I feel that a lot of people don't know what a periodontist actually does. And I like to really show people. I really believe in education. I believe that education really solves a lot of issues. I really like to take my time with patients because I make sure that a patient understands the reason why we do everything. You can simply come in and I can say, brush your teeth twice a day, 2 minutes, floss. I can say, this implant is this and this implant is that. But I make sure that you understand the pros and cons of both. I make sure that everyone understands the reason why they're doing something and the reason why they're feeling something. If you want, you can email me at rosalieperio@gmail.com. And this is us. We're so cute. You can call this number here and book a consultation. I'll be here. And if you have any questions, I will check the chat now. If you want to ask the question live, you are more than welcome to. Just take yourself off of mute and you are more than welcome to ask. Thank you. Okay, so our first question is going to be, how many days do I need to spend for implant surgery? This is a great question. Thank you, Laura. The pictures look a lot worse than what an implant actually feels like. I know that I showed kind of bloody pictures, but if you've ever had an extraction, the implant is way easier than an extraction. The way I explain it is that an extraction, which means that you're taking your tooth out, is you have a tooth that's a part of your body and then you have to remove it. So you're essentially removing a body part. That's going to be painful. There's nerves and blood vessels all in it. But whenever you place an implant, it doesn't have any nerves or blood vessels. It doesn't have that. Whenever you place the implant, the only thing that I'm accessing is going to be the top part where I have to create the incision. So some patients feel a little soreness around the incision or where the sutures are placed. But for the most part, the implant itself takes anywhere between maybe an hour to place. Now, at Dr. Katie Toe's office, we do spend a little bit more time because we include laser, ozone, and PRF with all of our surgeries. So that actually adds a little bit of additional time. After I prepare the implant site, we ozone it, we laser it so we can disinfect it, things like that before I place the implant. And then also we take PRF, so then it helps with healing as well. The implant surgery, whenever you come in, it can be in and out, max maybe 2 hours. Healing wise, I would maybe take the next day off depending on what you do. But most patients, whenever I call them to ask them how they're doing the next day, they're pleasantly surprised about how well they're doing. And they're like, oh yeah, I took my pain medication this morning and I haven't taken it since. So I hope that answered your question. If you have any follow-ups, I'm not sure if I answered it correctly, if that's what you meant about how many days. Thank you, Kaylee. Thank you. Do you perform any microbiological testing for implant patients before or monitor after patient or after implant treatment? What do you mean by microbiological testing? Are you talking about when we extract a tooth and send it to the get a DNA profile on it? Because we do that. But microbiological testing in regards to the implant site, if you can go into that a little bit, that can help me answer that a little bit better. Kelly, we are located in Katy, Texas, which is Houston, Texas. Do you still put an implant even if your gums have receded a lot? Great question. If your gums have receded a lot and you're missing a tooth, you can still place an implant, but the tooth will look longer because you have recession and the recession makes your teeth look long. It will really depend on your restorative dentist whenever they make the crown, if they're able to kind of mimic the way that the recession looks. But yeah, you can definitely place an implant even if your gums have receded. It just depends if you have enough bone, is whether or not you can place the implant or not. Okay. Oh, yes, we do saliva. Yes, we do saliva tests. We do saliva testing. We check underneath a microscope for all of our patients. So, yes, before the implant. And we also check for their vitamin D levels as well. So, I didn't really mention that in the presentation, but we do a lot of checking with their whole entire systemic profile. If you have dark spots that show up in x-rays, is it always a cyst? Not always. Not always. A dark spot on an x-ray just means that it's radiolucent, so there's nothing there. It could show up because you have a nerve. A nerve will show up as a little circle just like that, and it's just a black circle. Your sinuses show up as black right on top of here. Um, there are other situations where it shows up. So I would say that it's not always a cyst. The only way that you're going to know if it's a cyst is if you remove it and then send it to the oral pathologist where they can look at it under the microscope. And then only then can they accurately diagnose it as a cyst. Hmm. Laura, I'll get back to you afterwards about New York. I can't think of any biological dentists up there for now. Or you can just come to Houston. What if there are still pathogenic bacteria before the implant? So all of our patients who are receiving implants here, if it's major pathogenic, and that probably means that they have periodontal disease, and I do not recommend placing implants into anyone who has periodontal disease. Kind of like what I had mentioned, if you have this beautiful house, but a weak foundation, it will fail. So if you're having pathogenic bacteria in your mouth that is a part of the periodontal profile, I don't recommend that you place an implant because then there will be a lot of bacteria in there that will cause it to fail. If you're having a lot of pathogenic bacteria before an implant, that means that your foundation is not strong. Yes, actually, we have sedation options for patients who are a little bit more nervous. They Our options range anywhere from nitrous, which is laughing gas. Basically, you get a little nose piece like this, you oxygen flows through and a little bit of nitrous flows through, and it helps you relax. For some patients, that's enough. But for patients who have severe anxiety, we have a medical anesthesiologist that comes into the office. He's great. He has all of his own equipment. He comes in, he starts the IV. He's been really, really great. So we have nitrous here at the office, or you can even get IV sedation. And some of our patients do get IV sedation for the implant. The cost of an implant. So I will say that it can range. The titanium implant is going to be less expensive than the ceramic implant. Ceramic implants typically are going to be more expensive because the material. Now, it's hard to talk about a cost of the implant because I'm not sure if you are requiring a bone graft to go with that implant. I'm not sure if you know, need an extraction. So there's a lot of different factors that come into play. In addition to that, the implant itself is just one component. So remember how we were talking earlier about titanium being a few pieces? So we've got the titanium implant that goes in, the connector piece, and then the crown on top. And then you've got the ceramic implant where it has that one piece. Sometimes you need that abutment on top and then the crown. So it does come in several pieces, but the implant itself will range anywhere between $2,000 to $3,000, I will say. Yeah. Okay. So I know the chat is still going, but does anybody have any other questions? I would love to answer them now. All righty. So thank you guys so much for coming in and listening to this talk. I hope that I was able to educate you on the differences between them. I hope that this makes you feel a little bit better about coming in to get a dental implant. And I hope it helps you understand everything that you might need to get one, so that you can come in, talk to your dentist a little bit more. Um, Again, like I said, you can DM me, direct message me on my Instagram, email me. I love talking to people. I used to be a faculty at the dental school. So I would love to educate you guys. Oh, wait, we have another question. Do all periodontists do saliva testing? No, unfortunately not. Yeah. Thank you so much, everyone. I hope you have a great day. This has been a great series. Please, if you have any questions, do not hesitate to reach out. Okay? Bye.